here and excited that you're interested in this program. We're going to start off with brief introductions. We're going to walk through a little bit more about the program and the application process, and then we're hoping to reserve most of this time for Q&A to give you all an opportunity to ask us questions. So we'll go ahead and jump in. The three of us, Ari, James, and I, who are on this call, co-lead this program. A little bit of background on myself. I'm the Associate Director of Science Policy Engagement at UCSF's program on reproductive health and the environment. I also direct the Community Engagement Core that's part of the Environmental Research and Translation for Health, or EARTH Center. The EARTH Center is really the home to our Reach the Decisionmakers program, and it's funded by the NIEHS. So all of this work is funded through the NIEHS. My background is in neurodevelopmental toxicology. I used to be a staff scientist at Earth Justice as well. So my background has grown from my graduate studies into kind of more of a science policy career. And now a lot of our work through PRE and through the Earth Center is to try to understand the harms of toxic chemical exposures, the influence that corporations have on our health, and how to bring scientific evidence to regulatory agencies to try to strengthen the chemical regulatory process. And I'll pass it over to James.
Hey, all great to see so many folks here. My name is James Rocher Nolan. I have the pleasure of getting to work with Rashmi and Ari over at the Earth Center Environmental Research Translation for Health as the Associate Director of Community Engagement Core. And I also hold a couple different roles, one of which is Associate Director of the Western States Pediatric Environmental Health Specialty Unit, also at UCSF. And I'm coming out of a background where I used to do a lot of community-based participatory research in the field, collecting exposure data. And, I'm really excited to be over at UCSF, kind of thinking about how we can leverage that data more strategically to have those upstream influences and reduce people's exposures. So great to be here with everyone. And I'll pass the mic to Ari.
Hi, everybody. So I feel like Rashmi and James already gave a good background on the Earth Center. And I also work with Rashmi over at PRE, as well as James over at Western States PASU. I came to UCSF as a full spectrum doula, focusing in postpartum care mostly. And so my background's actually in reproductive health advocacy. So the environmental health advocacy work has been newer for me, which has been really exciting. And so, very excited to chat with you all about this program today.
Great. So as I mentioned before, the three of us co-lead this program. So if you have any questions throughout your application process, please feel free to email either one of us or all three of us. We're happy to answer any questions. So I'm going to jump into a little bit of an overview of the REACH program. So the program goals are essentially to train interdisciplinary teams of scientists, community members, public health professionals, and healthcare professionals to promote science-based solutions to environmental health issues by advocating to decision makers in the state of California. So through this process, you'll come together as, again, interdisciplinary teams. You'll come up with usually a community level environmental health problem that you want to solve, and you'll use evidence-based recommendations to try to solve that problem and work with regulatory agencies to come up with solutions. So why do this program? So Ari has given this presentation before, and she does a phenomenal job of explaining that, scientific findings from studies and papers that live out there in the scientific literature don't always make their way to regulatory agencies, to decision makers. So really there needs to be kind of a charted path to ensure that science and sound science, the best available science, is what is the basis for public health rulemaking. This is a lot of the work that we do at UCSF PRE and at the Earth Center, is to ensure that regulatory agencies have the best available science. But again, science doesn't always make it there on its own. So we need conduits. So people that are part of this program work together to try to elevate that best available evidence and strengthen policies that would promote public health and solve those environmental health issues. This also really, helps people who are interested in, pursuing a career in environmental health or in kind of understanding how to connect the dots between science and policy, hone those skills. You're going to be coming up with ideas as a team, working together to find solutions, interacting with decision makers at California EPA directly. Some of our fellows from the previous program even set up meetings with state legislators. That's not entirely what we asked for, but they kind of went above and beyond, and it was very successful. So it really is an immersive experience that kind of throws you into the water, and we try to, along the way, equip you with the tools that you need to be successful. A little bit more kind of granular information about the program. So I mentioned that this is an immersive training program. You're working with interdisciplinary teams to solve environmental health issues at the community level. It's a year-long fellowship, and so throughout that process, we start by, again, providing you with tools and resources to first understand kind of the science behind environmental health issues, understand how to develop a policy ask, so the different tools that you'll need to come up with a white paper and come up with an elevator pitch and messaging. And then we do mock presentations, so the fellows will actually present their policy ask to a mock panel of judges, just to kind of, again, prepare you for those scenarios where you're having agency meetings. And then towards the end of the fellowship, you'll actually set up meetings with decision makers in California EPA and travel to Sacramento to actually have those meetings in person and advocate your ask. We do have a very modest honorarium that we can offer each fellow, but really and Ari will walk through kind of the specifics of the costs associated with the program, et cetera, but they are anticipated to be minimal. The honorarium is also very modest, and this is really about the educational and immersive experience. You'll also be plugged into a very vast network of REACH alumni who have been and had very successful careers. If you could go to the next slide, I think there's a little bullet point in there about our REACH alumni. It includes Diana Ramos, who's the current Surgeon General of California. So really, it's an amazing network to be plugged into and a great resource to take with you after you finish the program. A little bit about the history. So this program originally was housed within PRE, which all of us have talked about in our intros. It started in 2010 and ended in 2017, focused at the federal level. So fellows were actually coming up with projects dealing with federal policy, and they were traveling to DC to do their advocacy meetings. Over that course of time, we trained over 120 fellows from many different states, representing really all regions within the US. And again, as I mentioned, so many of these fellows have gone on to have very successful careers in medicine, academia, and public health. Last year, we relaunched the program under the Earth Center and refocused it to be at the California state level. So that's kind of the major difference between the previous iteration and the current version. But our last year's relaunch was very, very successful. And if you want to go to the next slide, we had an amazing cohort of 19 fellows spanning, we had physicians, we had nurses, we had professors, we had graduate students, and we had community advocates. We had 3 very diverse interdisciplinary teams that worked on a wide range of issues. So we had one team that was focusing on coming up with policies to reduce harmful chemical exposures in the Richmond shoreline area. They worked with the California Water Board. They also worked with the Richmond Shoreline Alliance, which was a local community group, to try to come up with solutions. The second team was working on trying to improve the methods for identifying pesticides in groundwater. And they were working with the Department of Pesticide Regulation at California EPA and the Office of Environmental Health Hazard Assessment. And the third team was focusing on the combined impact of heat stress and chemical exposures in farm workers and trying to improve methods to protect them. They also worked with DPR, OEHA, and they organized kind of a mini Hill Day at the end of their experience and met with, I think, 8 different state legislators, which was phenomenal. They accomplished a lot collectively. So, overall, all of them said that they did kind of hone those skills in science policy and advocacy and setting up meetings and understanding how that process works. Each team developed respective white papers focused on their different policy projects. They were excellent, and I think most of them are available on the website if you're curious to read through those. There were multiple meetings that were set up with agency staff at California EPA, and then, as I mentioned, more than 8 meetings set up with state legislators. And really what was exciting to see is the work has continued beyond the end of the fellowship. This op-ed that's screenshotted here in the Sacramento Bee was just published by the team that worked on heat stress and pesticides last week. So they are very much continuing the momentum forward and trying to continue elevating and advocating their environmental health solutions. On the right is a cartoon that the first team working with the Richmond Shoreline Alliance made to try to kind of garner public education and awareness around the issue of volatile organic compounds and how they can move from groundwater into the home, which was really phenomenal that they were able to put that together. Next slide, please. So I'm going to pass it over to Ari to talk a little bit more about program logistics.
Thanks for that good overview, Rashmi. I will try to kind of move through these quickly because a lot of this is available on the website and we only have plenty of time for questions. So just kind of hitting the big key points here about what the structure of the program is going to look like for the next year or so. And we did want to highlight that there are some in-person elements. There is a big orientation at the beginning, kind of get a chance to see everyone's faces and talk about your team names and really kind of start to brainstorm your policy proposal ideas and getting to meet the mentors. And there's going to be a lot of like inspiring speeches and things like that to kind of start off strong. And then we would resume again in person at the very end of the program, which would be December 2026. And that will be sort of like a half-day report back where all the teams come together and they share presentations about the meetings that they had and, you know, successes and challenges. And it's really kind of like this great workshop experience for people to help each other out in terms of like continuing the work and, you know, what they can do to move forward. And but in between that, we'll just have monthly training webinars, and those are all via Zoom. And all of those dates are also going to be on the website as well. And then, of course, you'll have your own team conference calls, which are scheduled by your team to touch base on your policy project as we go along. And then, as Rashmi mentioned, we will have some funds for teams to go to the Capitol or whatever, wherever exact location you're going to be. And then mentor support for each team. And then you also have a $500 honorarium, and that's to kind of cover, you know, a little bit beyond travel costs, but again, it is quite modest. And so, and program dates, as mentioned, are on the website. I want to highlight that the application deadline is December 1st at the very end of the day. And if you want to review all those program dates, you can go to our Earth website. As mentioned, the in-person orientation is February 20th. And then our webinars will start on March 18th, and those will be monthly for about 2 hours a month. And kind of the same time, it's like a Wednesday, middle of the month. And then the practicum, which is your agency meeting, can occur anytime between October or November. So that's going to be completely dictated by your teams and when you're able to schedule. You know, you have to work around really busy people's schedules. And so oftentimes it is their own availability. So we give you a little bit of a window to accomplish that. And then as mentioned, there will be the in-person report back, which will be in San Francisco again, December 4th, 2026. Cost of participation, we really try to be mindful of accessibility for the program. So we expect that everything's going to be very minimal. I would say like the majority of the costs come from that in-person trip to Sacramento for the practicum. And each team gets a pretty solid, you know, scholarship to make that happen. And then of course the $500 stipend, which is given at the end of the program. And then participants are expected to make some time during their week in order to accomplish all the different assignments and, you know, the policy project itself. Unfortunately, travel to and from San Francisco is not covered. But other than that, we should have everything via Zoom and via email, and we check in as often as possible. And then I will kick it to James to talk a little bit more about the actual application process.
Much, Ari. So eligibility, participants must live in Northern or Central California and be willing to travel to in-person events, as mentioned, mainly those two in-person meetings at UCSF, as well as a visit to the Capitol. So for individuals, we're looking for researchers, community-based leaders, public health professionals, and healthcare professionals. And individuals will be assigned to a team, but you can also apply as an entire kind of pre-made team. And we'll be looking for existing coalitions of 4 to 6 individuals. But we want to note that those must include a diverse mix of kind of backgrounds with regards to researcher, community-based leaders, public health professionals, and healthcare professionals. Next slide, please. Application process, I put some key links into the chat, but you can also scan the QR or just go directly to our website. The application deadline, as already mentioned, is December 1st, 2025. So start thinking about all the components and getting those together. If you're applying as a team, each person must submit an application. Select one contact person per team and list them in your application. And that contact person should email earth@ucsf.edu with a list of those team members, just so we can have a nice cohesive sense of what that team looks like. A selection committee will review applications and interview finalists, and then a final decision notice will be sent out no later than December 22nd, 2025. Next slide, please. Thank you. So participant selection, we'll be looking for individuals and teams based on previous experience in or knowledge of environmental health, interest in environmental health and science policy with emphasis on vulnerable populations, for example, pregnant people, children, environmental justice communities, etc. Commitment to participant requirements, which are listed in our website. Organizational support for or agreement with participation, if you have a pre-existing employment, making sure that scheduling and all that kind of stuff works out. And match with program model, especially with regards to a history of working well in collaborations or on teams. Continued, fellows will be chosen to ensure that each cohort meets the following criteria. We're looking for balanced teams. Is there community-based leaders, researchers, healthcare professionals, and public health experts represented in that team? We're looking for a diversity of experiences, ranging from students to seasoned professionals, a mix of emerging and established community organizations. And we're looking for a diversity of people, who serve and or are representing populations impacted by California state government decision-making in the field of environmental health. So for team policy projects, each team will choose their own policy project as the basis for their engagement across the year, and with their subsequent, California state decision-maker meetings in Sacramento. Those meetings will be held later in the year, so you've got almost a whole year to think about them and prepare for them. We're looking at October to November kind of time range of 2026. And each team will come up with, evidence-based policy asks to improve environmental health. So project examples, we've got a couple here that might resonate with some folks, but thinking about advancing Cal EPA's efforts to reduce microplastics exposure, working with DTSC to advance regulation of microplastics in California to reduce exposure and associated health risks. Another example is changing environment and toxic chemicals, developing recommendations for OEHA to integrate climate-related factors into chemical risk assessments to better capture real-world exposures. Another example is, food toxicants and neurodevelopmental harm, thinking about collaborations between DPR, OEHA, and other agencies to create a coordinated strategy to reduce neurotoxic chemical exposures from food and protect children's brain development. There's tracking industrial chemical releases in California, where you can analyze industrial chemical releases in a fence line community and recommend improvements to Cal EPA's chemical release tracking and reporting system. Or also a cumulative risk assessment for pesticides project, where you'd work with OEHA and advocacy groups to propose a cumulative risk assessment approach that addresses multiple pesticide exposures and non-chemical stressors affecting farm workers. And next slide, please. But you can also totally choose your own projects, so don't feel limited by those. Hopefully they kind of inspire interest, and maybe there's even spin-off ideas that you're thinking about right now. But applicants, as individuals or also as whole teams, can suggest your own project idea. We just ask that in your application, you describe the environmental health project you'd like to work on, including relevant regulatory authority, details like the community or region most impacted or that you'd want to work with specifically, and the scope of the issue, and propose regulatory changes. What exactly do you want changed and how you want to go about doing that. And next slide, please. Oh yeah, thank you so much.